House Bill 90. Drew, would you read that in for us, please?
Mr. Chairman and members, House Bill number 90 by Representative Marcelle provides relative to the composition of the Louisiana Department of Health, creates within the department an Office on Women's Health, provides for the purposes, duties, and functions of the Office on Women's Health, and provides for related matters.
Representative Marcelle, would you like to tell us about your bill?
Thank you, Representative C. Denise Marcelle, District 61. Thank you, Chairman and members of this esteemed committee. I do want to start by saying that this bill, you guys passed the same identical bill last year's, pretty much identical. There's been some changes to it, and it actually creates the Office of Women's Health. I feel really odd since there's no women on your committee. I see Representative Moore is not here. I was looking for her support, but I guess I'll just have to take the support of the chairman, and I'll appreciate that along with the gentleman. But as I've stated, this bill came before this committee last year, and it actually establishes the Office of Women's Health within the Department of Health. The reason that I have been asked to bring this bill by Ms. Alma Stewart, who's the president of the Louisiana Center for Health Equity, along with so many other members and organizations throughout our great state, is because of the issues that we have seen that our women face throughout the state of Louisiana. This would certainly support healthy behaviors and improving women's health throughout our state. It would reduce maternal health disparities, also address the factors of chronic diseases such as diabetes, obesity, cardiovascular conditions that occur in a high percentage of women. These issues that we face throughout the state, we believe will be better served if there's a focus within the Louisiana Department of Health as its own office under women's health. And we appreciate you passing this bill on last year. We ran out of time on the other side. It passed here, it passed off the floor, but it ran into some problems on the Senate side, and we ran out of time pretty much. But there is a fiscal note, and it's zero. I will say that I've worked with the department, and they have created the 5 positions that we need within their department, and so that's why you'll see a zero fiscal note. And I ask for your favorable passage, but prior to doing that, I'd like to introduce Ms. Alma Stewart, who has been the lead organizer for these efforts, and thank her really for allowing me to carry such important legislation.
Thank you so much, Representative Marcelle. And good morning to the Chair Bagley, and to the members of this committee. It is a pleasure to be back here again this year.
Excuse me, would you introduce yourself?
I'm sorry.
That's all right.
I thought she did, but my name is Alma Stewart Allen. I am the president and founder of the Louisiana Center for Health Equity. I am also the convener and organizer for the campaign to establish the Louisiana Office on Women's Health.
Thank you.
And so going along those lines, first let me say thank you for your support, as Representative Marcelle said, on last year of this, the creation of this Office on Women's Health. I do want to read the list of organizations that I am here representing today. We did provide to you a handout and the list for the record, if you will allow me, because these are the organizations that I am speaking on behalf of today. We try to be very efficient in organizing our efforts around this office, getting this office established. The partner organizations or member organizations of the campaign are the American Association of University Women of Louisiana, Abella La Femme Society Basic Necessities, Marine Wellness and Community Support Center, the Black Women's Roundtable, the Campty Community Development Center, Caramore Industries, the Center for Hope, Children and Family Services, the Center for Resilient Individuals, Families and Communities, Daughters of Zion United, the DPEC, Family Road of Greater Baton Rouge, Grace and Love Consulting, Her Institute, Hadassah, New Orleans, Healthy Communities, the Health Education and Promotion Solutions, Health Birth Ambassador, Healthy Community Resources and Advocacy, Heart and Hands, IWO New Orleans, LAMPS, League of Women Voters of New Orleans, League of Women Voters of Louisiana, LIFT Louisiana, Louisiana Cardiovascular and Limb Salvage Center, the Louisiana Center for Health Equity, the Louisiana Coalition for the Equal Rights Amendment, the Louisiana Federation of Business and Professional Women, Louisiana Now, Louisiana Progress, the March of Dimes, the Mary Amelia Center for Women's Health Equity Research at Tulane School of Public Health and Tropical Medicine, Metro Council District here in Baton Rouge, National Birth Equity Collaborative, National Coalition of 100 Black Women Greater New Orleans Chapter, the National Congress of Black Women, the National Council of Jewish Women Greater New Orleans Section, the New Orleans Maternal and Child Health Coalition, the New Orleans Now Chapter, Nikki Scott Incorporated, the O'Brien House, One Soul Delivered, Operation Restoration, Planned Parenthood Gulf Coast, Pumps to the Polls, Representative Mandy Landry, Saul's Light Foundation, Sister Midwife Productions, the Family Tree Healthy Start Program, the Preemie Mom Coach, LLC, the Promise of Justice Initiative, the Queen Esther Academy, 360 Resource Project, and Top Ladies of Distinction, Nunperel Chapter, and Tulane University. All of these groups and organizations have signed on in support of this Office on Women's Health. And as you can see, we represent a very diverse spectrum of the state in terms of the demographics of the state from across the state. I am pleased to be here to speak on their behalf. House Bill 90, I'm going to be very brief because I think the most important thing that I have to say today is the membership of this, the strength of the support for this office from the community, and in particular from women and women's advocacy organizations. So I'm going to be very, very brief in just saying that I am here. I have prepared statements and some statistics, and I'm happy to provide those if anyone would like. But I think pretty much there's broad consensus for the need, understanding the need to improve women's health outcomes. Louisiana is at the bottom when it comes to women's health, and we want to do better. We want to have a better quality of life for our women and children and families. So I'll stop there.
All right, thank you. I will say that the Secretary and I have had several conversations about this because I didn't understand. You know, I know there's a physical note, and you said 0. I'm not sure what the official is, but I did talk to the Secretary about that. She explained that they were going to take an existing personnel and move them in, and there would be a chair, a commissioner, a secretary. There would
one
be
position, right?
Right, there would be one position they'd have to pay, and that's, I guess, would be the physical note with that. So she was just explaining to me how it worked. I mean, I remember the bill, but she went a little more depth, and I wanted to be sure that the LDH was along with this, and they were. Actually, we have an amendment. Now, there he is right there. Representative Cruz has an amendment. Drew, would you read that in, please?
Mr. Chairman and members, this is an amendment in concept. It has not yet been reduced to writing, but I'll refer to a document that is already online. If you followed last year's House Bill 193 by Representative Marcelle, there was a House Committee on Health and Welfare amendment to last year's House Bill 193, which was also the Office on Women's Health bill. This will be an identical amendment to what you see on as the committee amendment that was offered and adopted last year. This amendment would occur on page 4 of the bill at the end of the numbered sections of the page. So basically at the end of the proposed law, there would be a new subsection inserted that would read as follows. The Office on Women's Health shall not do any of the following 1, utilize any personnel or funding to promote abortion. 2, coordinate with any entity that promotes abortion. And there would have to be some technical changes previous to that in the bill to accommodate the insertion of the new subsection, but that is the substance of the amendment. It is a prohibition on the new office utilizing personnel or funding to promote abortion or coordinating with any entity that promotes abortion. And this concludes the concept amendment.
Thank you, Drew. Yes, Representative Cruz, bring that. Would you like to talk about that, Mr. Representative Cruz? You don't have to, but you may. Let's see. Is that you? Are you on? Punch your light. Well, on yet?
He doesn't really need to speak.
I just want.
Thank you.
Sorry, Mr. Chairman, you have it on mine.
Thank you. It's a little hard to read this.
I just want to be prepared to answer any questions from Representative Marcelle. This is what I call a friendly amendment. It's friendly to the children, so I hope you'll be favorable to it.
All right.
Let me just respond by saying LDH currently does not promote abortions, and this bill has absolutely nothing to do with abortions at all. I said that last year. I'll continue to say that this is about improving the health of women throughout this state, and it has absolutely zero to do with abortion. So,
And I just want to make sure it stays that way.
Right.
Thank you, Representative Cruz, for your friendly amendment.
May I speak also regarding this amendment?
Yes.
The coalition of members that I read the list of represent a broad spectrum of women who come from various perspectives in terms of reproductive health and reproductive rights and abortion, from one extreme to the other. We have been able to come to an agreement to support this legislation in its current form. Attaching such an amendment, I think, would jeopardize the legislation because the law already is very clear about abortion. This Office of Women's Health has really nothing to do with abortion.
And how would this amendment deter from the goals of the bill?
Because it creates some level of controversy for women who are advocates for abortion. They have agreed to support this office, and we don't want to make it about abortion.
I thought it was really just about women's health, and I don't see how this deters from that in any way.
Because abortion and abortion rights is not, I have here, and I would like to share it with you. We have, and we use the definition of the Centers for Disease Control and Prevention on women's reproductive. May I? We use the federal CDC definition, which is silent on abortion. The federal government does not, in their office on women's health or their definition of reproductive health, they do not include abortion. And so we would like, if at all possible, to avoid the controversy that comes with confusing this office and the mission or purpose of this office with abortion.
And I'm concerned about the controversy it'll cause without having that, because the majority of Louisianans would like to see that practice gone. They'd love to see all the kids survive.
Let me just, Representative Cruz, the Louisiana Department of Health currently does not promote abortions. Would you agree with that?
They're different kind of promotions. I'll say they don't outright support that.
They don't outright support it?
Yeah, they don't outright support.
So why is it necessary
deter.
that we put an amendment on this bill? Because they currently don't do that.
Well, much like we do many other things, we prevent something happening later, and this is purely preventative to make sure we don't encourage abortions.
Well, we're not encouraging it. This
Exactly.
bill,
And this won't-
has absolutely nothing to do with it. But what I will do is continue my conversations with Representative Cruz, and we'll continue to talk. We are seatmates, kind of cross the aisle from each other. I will allow.
You make good friends.
We're not good friends. Let's clear that up.
Well, I will say that as Drew read out a minute ago, this amendment was on the bill last year.
And
So
I will allow
was
it.
not-
I will allow the amendment to stand as is, so I can continue my conversation with Representative Cruz, and so that my bill can move forward to the floor.
Is there any other? I know Representative Miller, you want to speak, but not about this, correct? Okay. Is there any objection to the amendment by Representative Cruz? Seeing none, the amendment is added. Representative Miller was next.
Mr. Chairman, I just wanted to state that we passed this bill last session, and I think it got caught up in the length of time, so it didn't pass in Senate Finance. But I just make a motion that we move this bill favorably at the appropriate time.
Thank you, Representative. Representative Larvadain.
I concur.
All right. Representative Echols.
Thank you, Mr. Chairman. I'm supportive of the bill in its current posture, but I just had a few technical questions I wanted to ask to have some fabric understanding as we move this and the process for healthcare forward. I'm a big believer in women and men's health and trying to improve outcomes in our state, and I agree holistically that we're at the dead bottom last for most of these categories, and we need to do things more strategically for sure.
I'll make sure your wife knows that.
Thank you. Thank you. What has the current administration not been doing that this new office will be able to create and attack? I mean, give me the specifics that you're trying to hit that we're not doing right now that this office will accomplish.
Well, it's not necessarily that they're not doing it. We want a coordinated effort and a focus specifically on the issues that women face throughout the state. So if you have a department, and as large as LDH is, if you have a specific department just addressing these needs, then they're going to focus on women's health issues and those numbers that we talked about, the mortality rate and those diabetes numbers. That's going to be their primary focus. So that office will be coordinating with other people throughout the state to make sure that those numbers, we're not at the bottom. So that's pretty much what this effort is, to drive meaningful change as it relates to women's health.
So are you familiar with some of the strategies that have been deployed by LDH over the last 10 to 20 years? For example, reducing the number of C-section births versus natural births, low birth weight, and numerous other things that I would contend are women's health related items. Do you say or suggest that those items, the past endeavors, would all roll into this office and be done in one funnel versus broadly through all the health plans?
Absolutely.
Okay. Do you think we should have an Office of Men's Health?
If you bring that bill, I will read it, sir.
No co-authorship status. I heard this question yesterday in a Supreme Court debate. Can you define a woman?
And I define a woman. Well, it would be myself and Alma Stewart right now at the table, and we both have on pink. But a woman is obvious who a woman is according to how God has made her.
Biological standards.
And the biological standards that God has made her, period.
So would this office promote biological women's efforts or other?
This question has come up before, and I think I know where you're going.
I'm just trying to get clarity on the issue because it's a new office.
The way we have defined it is if an individual identifies as woman, as a female or woman, whether they're trans or however they got there, then this office would serve them. If they define themselves, their identity is as a woman.
Thank you. I have no further questions.
Okay, thank you.
Representative Miller, do you want to talk again? Representative Cruz.
Thank you, Mr. Acting Chair. Well, that brings up some important questions. First of all, do you realize that women make up the majority of the population of Louisiana? So wouldn't that be like the primary function of the Department of Health if we look at it that way? I mean, that's the majority of the population is women.
Let me just say that the department would currently, whoever they're currently serving as women, we are not changing the definition of who they serve as women. So these policies that you're talking about are already in place through the Louisiana Department of Health. Whatever those policies are, whomever we currently serve, we're not going to change that. Whoever that is that the department currently serves as women. I'm not changing. My bill does nothing to change that.
Okay, what I'm saying is, what's the purpose?
Cardiovascular diseases such as myself, women who have the low birth rate. These are the things that we're trying to target and make sure that we're not at the bottom of the list. This is certainly not about abortions. This bill is not about transgenders. This bill is about women's health. And I don't want us to get into the weeds of us trying to make this bill about something that it's really not about. And you know, I would respectfully ask that you would leave the bill in its current form and let's move forward and we can have those conversations.
These are some important debate points here. I mean, if women make up the majority of the population, I would think that's LDH's everyday job should be taking care of that. It's not like there's some small minority out there that aren't getting attention, aren't getting any studies or anything. I mean, that should be their core mission. Is LDH not doing a good job already?
Well, I'm not going to say that LDH is not doing a good job. What I want is a department that has a focus. And they don't currently have that. And that's what this legislation is about. And that's why we have these organizations that I'm sure you've read, and she read the list, a lengthy list of organizations that are supporting this legislation.
You know, but most things where there's a binary choice, there's only one or the other, as most human beings understand, men and women. Why to have a department when it's one or the other? Why have a whole separate office to take care of the majority?
Well, I mean,
that's the whole function of LDH is take care of human all the way around.
An office on aging, an office.
Correct. There's office on aging in there because that's a population. There are specific offices as it relates to specific groups. And we're just asking, because of the mortality rates, because of the low birth rates, because of the conditions of women in the state of Louisiana, we're asking for a specific office. And until now, no one has actually disagreed with us that this is needed. And again, this legislation passed this committee last year. It passed the House floor. It passed the Senate floor. And so I'm asking for you all to allow this legislation to move forward.
Well, if you remember, I support all the objectives within it. I just don't see why LDH just doesn't do these functions already.
Well, you can ask them that, sir. But my bill.
Maybe they're here. We got some here?
No, they're not here.
Interesting. Well, the bigger question at this point really is anybody who identifies as a woman could avail themselves of these services.
I'm going to say this again, Representative Cruz. The Louisiana Department of Health currently serves who they serve as women and who they serve as men. My bill will not change the definition of who they're already serving, period.
Sure. But we talk about all the statistics you're talking about, birth weight and all those things. They are intrinsic to women who are biologically women, right? So if I decide I'm going to go take the services, what am I going to get? What benefit am I going to get? This is focused on biological differences. Why would we include people that are not biologically women?
I don't know how else to answer that other than to say I'm not changing the definition of what they're currently doing. That is not the.
Well, maybe we need to include a definition of what a woman is in the bill.
Maybe you need to include the definition with the Department of Health on all of the things that they're doing within their department and not this bill.
Look, some of these are well-intentioned, but I think they have the wrong effect. The Woman of the Year is a man. Did you see that? The Woman of a Year is biologically a man. Do you think that's advancing women's rights, women's health, anything?
I'm gonna stick to this bill and that's what I did not want to do, Representative Cruz.
Hey, hold on. let's please pertain with the information
Well,
on the bill.
I am trying to. Women's health. So I'm just trying to function on the title of the bill there.
Health has nothing to do with who's the woman of the year, sir. Nothing, not this bill.
But it has everything to do with who is a woman.
That issue has nothing to do with this bill.
It should. I mean, it says women's health. Department of Health for Women. I'll tell you what, I can support this bill if we'll put in a definition there of what a woman is.
I'm not going to change the bill in its current form. I've allowed you to put an amendment on there that I allowed last year, and I'm not going to change the bill in its current form. And I'd ask this committee to vote this bill out so that I can have the debate on the floor. Thank you.
Representative Larvadain.
Thank you, Mr. Chair. I want to first, I saw the line of questioning, and I apologize to these young folks because that's not who we are. We want to keep young folks in this state, and we have to deal with issues like that. But what you saw, that's not the reflection of everybody in here. I'm offended by that. Let me ask Representative Marcelle some questions. Isn't it true that this state leads the country in low birth weight?
Yes, sir.
Isn't it true that during the birth process we lose more women in that process to death?
Absolutely, sir. So I'm actually trying to save women's lives and children's lives, the same children that Representative Cruz seem to be talking about. I'm trying to save those babies with the low birth rates, those mothers who go through and may not make it out of the hospital.
Isn't it true that women lead the poverty rate because they earn less than men in wages?
Absolutely, sir.
Isn't it true that this bill is just to help women and deal with women-related issues?
That's correct, sir.
The most precious person I have is my mom and my grandparents. We want to keep them healthy. Is that it?
That's correct, sir.
You're not trying to create some leftist wing, and you're not trying to deal with abortion. You're just trying to deal with women's health.
That's correct, sir.
And we're hoping and encouraging that the young people in those white coats will stay here and provide quality health care for the women of this state of Louisiana.
That's accurate.
You don't have any alternative motive to do anything other than that.
That's all I'm doing, sir.
And what's troubling it to me is that don't women have the majority, control the majority of families of single women who need health care and need assistance?
That's correct.
And that's why we're here.
That's why we're here.
And isn't it true, isn't it true that 65% of every child born is a Medicaid child? Isn't that true?
I think those numbers are accurate.
And aren't we trying to find a way to keep them off Medicaid so they can have a job and have insurance?
Absolutely, and we certainly want to address the diabetes and obesity and the other things that the significant gender wage gap. You mentioned all of that. We certainly want to affect change when we can for women in the state. And as Representative Cruz have said, the majority of the people in the state are women. They are people who are leading their families many times by themselves, single mothers. We do want to protect the birth weight and rate in this state, which saves children, the people that Representative Cruz says that he don't want aborted. I want to make sure that those birth rates are up, that they have a better chance of living, and that's what I want to do. I want to save the children and the women of this state, and that's what this bill is about.
And if we provide adequate care for women, we can have adequate families that are healthy.
Absolutely.
Thank you.
May I make a comment? I just want to
Yes, ma'am.
applaud the
I can't believe it.
medical students that are here as well. And we know that improving women's health in this state and the quality of life for women and children and families will help to keep our medical students, our doctors, our young doctors in the state of Louisiana. Currently, we have a serious problem with retention. We train them and they go work someplace else. Improving our health outcomes and the conditions here in Louisiana, moving us from being at the bottom, being the least healthy state in the country, will help to keep our doctors, our medical students in the state of Louisiana. We need them here.
Thank you, Representative Miller.
I'll be brief, Mr. Acting Chair. I would like to speak on several things. First, to the committee. It's the first bill of the session, which I thought was going to be an easy bill that was just going to fly out of here.
We thought so, too.
I really would ask us to stay focused on the bills and let's not let national politics get into Louisiana as we're trying to better the health care of our state. Ms. Marcelle, your bill is focused on women's health, a subject that LDH have acknowledged that we're failing in the state of Louisiana. There's a lot of co-determinants of what causes the bad pregnancy outcomes, the increased deaths with pregnancy, whether it's obesity, whether it's diabetes, whether it's ovarian cancer, whatever caused it due to possibly the woman not getting pre-screenings or not getting cervical screenings, could be due to lack of access, could be many reasons. And I think LDH have identified all of those reasons, but they have such a big challenge in the state of Louisiana with our healthcare needs that they think if we can focus a division specifically on women's health, that we can develop one uniform plan to work on those social determinants of health to better the health outcomes of women, correct?
Correct.
That's simply what this bill is about?
That's simply what it's about, sir.
Okay. And I'm a true Catholic. I understand the amendment that was put on, but anything else, this bill doesn't pertain to. We're focusing strictly on women's health.
Absolutely.
Listen, I thank you for your bill. Sorry that you here for an extended period of time. I thought you'd have been out of here in 5 minutes. For full disclosure, LDH stated they're debating this bill on the Senate side now with Senator Barrow, so that's why they're not in the stands in the seats, Mr. Acting Chair. So at the appropriate time, I ask that we move forward.
Thank you, Representative. Representative Carter.
Representative Marcelle, I've been a strong advocate of women's rights from the beginning. In fact, in my first 12 years before I was term limited, I actually authored a bill for the state to adopt the Equal Rights Amendment, which of course didn't pass, but I tried. And I voted equal pay for women every time. And
So you want to co-sponsor my bill? Is that what you're saying, Representative Carter?
I will tell you that when you afterwards, I will co-author your bill if they send a sign-up sheet around.
Thank you.
We in St. Helena and some of the rural areas particularly, I have really stressed health care to my area. We were the first parish in the whole state to have a school-based clinic at every school in our district in St. Helena. That helps. We have Southeast Medical Systems, which provides very good health care for all of our rural areas. I got one in Kentwood, I got one in Greensburg, and I got one in Independence. Then over in East Feliciana, Representative Adams and I have a very good medical clinic that does the same thing that Southeast does. But one thing we have a shortage of, I believe, people from my area have to travel long ways to go to an OBGYN. I wish there was a way we could get more OBGYNs into the rural areas, because I believe that, again, maybe this bill and this office will set up a way to help us catch more earlier problems with the pregnancies than we are now. Because right now, rural people have to go, 50 to 100 miles to go see an OBGYN. I would like to see it where we had OBGYNs out more in the rural areas like we have at Southeast Medical Systems and things. But anything we can do to make this place a healthier place for women, for men, for everybody. I believe the rural areas are in particularly stress over health care. I got two nephews are doctors. I don't see them ever coming to a place small as where I live to be doctors. I expect them to be in more metropolitan areas, But I would like to see a strong push to have more come to the rural areas. But I think this is a step in the right direction. And like I say, Representative Marcelle, I'm willing to be a co-author of this bill because I feel so strongly that we need to do everything we can to get us off the bottom on the health statistics, especially for everybody, our women, our men, our aged, everybody. We need more health, and we needed more help, particularly in the rural areas. That's all I have.
Thank you, Representative Carter.
I'd like to say also, in talking to the Secretary, there's no question that women in their life have much more medical or many more medical problems than men do. I raised 3 daughters, and I know about all that. I was married. I have, we all. I wouldn't want to have the problem that you have, and I think that.
Thank you, Representative Bagley. I really
Well, actually, I'm trying to help you, but I would say that I think a separate branch of LDH that specifically dealt with that is needed. After I talked to the secretary and she explained to me how they were the working, she sold me on it. I know that she is in favor of it. We will find now. I think Representative Miller has moved to move this motion forward. Are there any objections to that with amendments? Right, Hospital 90 with amendments. Any objections? Seeing none, you are passed to the House floor.
Well, thank you so much, and I appreciate each of you for co-authoring this legislation. Thank
Well,
you
we
so
don't
much.
have, we haven't yet, but we will pass
all of the men.
We will pass. We need to talk to Ms. Moore, Representative Moore, and get her here more often, I guess.
All right, thank you so
Normally
much.
she is here, but thank you so much.
Thank you,
Yes.
members.